Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. With us is Dr. Dina Hinshaw, the Chief Medical Officer for the province. Dr. Hinshaw will provide some remarks, and then we will open the floor for questions.
Thank you, Shireen, and good afternoon, everyone. Before I share numbers for the past 24 hours, I want to talk about shame. This is a common theme I have been hearing over the past few weeks, reported by our contact tracers, who are talking with people who test positive and their contacts. This worries me. Shame is an emotion that drives people to hide or to cover up what they are ashamed of. It can be triggered by anger and judgment from others or by an individual's own beliefs about what has happened. The more that COVID drives shame, the harder it will be to prevent, as people will be less willing to be forthcoming about their symptoms, less willing to be tested, and less willing to be honest with contact tracers about their activities. We need to fight shame with compassion. Let's be honest, living with COVID-19 is really hard. We are all tired. It is easy to be frustrated or even angry if our lives are disrupted further by an exposure to COVID from someone in our circle. And yet many of the cases and outbreaks we are investigating have been triggered by a series of unfortunate events. I confess that I sometimes forget to sanitize my hands after opening a door and touching the door handle. None of us is perfect. We all make mistakes. We are all trying the best we can to follow the rules as much as possible. But one slip at the wrong time and place can lead to transmission. We must be compassionate with those who test positive. We must support those who have even mild symptoms to stay home and away from others without shame. Our success depends on this. As we head into one of the last weekends of summer, I want to share a quote by Marianne Radmacher that was shared with me a few weeks ago that I think is helpful as we continue this pandemic journey together. She says, "Courage does not always roar. Sometimes courage is the quiet voice at the end of the day saying, 'I'll try again tomorrow.' If we face COVID-19 with courage and compassion, we will get through." Turning to today's numbers, we identified 103 new cases in the last 24 hours. There are now 1,084 active cases in the province. Currently, 43 people are in hospital, including 12 in intensive care. Tragically, I am reporting one additional death today. It is tempting to become numbed to these numbers after a while, yet each number represents a person who is left behind grieving family and friends. I offer my condolences to all who are grieving losses of any kind right now. Overall, more than 855,000 tests have been completed on over 690,000 people. The lab completed more than 9,200 tests in the last 24 hours. I anticipate these increases are likely due in part to teachers and school authority staff who are choosing to be tested. I continue to encourage all teachers and school authority staff to get tested before the start of the school year. As I have mentioned, this testing is helpful as a baseline only and will not guarantee safety in our schools. I know that many parents, teachers, and students still have questions and worries about Alberta's school re-entry plan. Many of these questions are around what evidence informed the public health recommendations we provided to the school return plan. My advice is based on a review of evidence on what has worked or not worked around the world, and on what science and medicine have learned about children and their experiences with the COVID-19 virus. Some may wonder why we would reopen schools at all during a pandemic. My answer is that we must look at the overall health of our population and everything that contributes to health. We cannot simply focus on COVID-19 alone, as there are other risks that must be factored in. We know a great deal more about the virus now than we knew 6 months ago when we were dealing with our first cases. We also know very clearly that measures taken to prevent the spread of COVID came with their own risks to health and wellness. We must learn how to live with this virus and how to find the right balance between preventing uncontrolled COVID spread and preventing the harms that come from shutting down essential parts of our society. The Canadian Pediatric Society, the American Academy of Pediatrics, and other pediatric organizations agree that a safe return to school is critical to the physical and mental health and well-being of students and families. School is about more than education. It is equally important to a child's socialization, mental health, food security through school nutrition programs, and protection from other harms that may result from additional stress or financial hardship if parents are not able to work. The multifaceted value of school is clear. To open schools safely, my recommendations were based on a review of all available evidence, including summaries by many groups, such as the European Centre for Disease Control and Alberta Health Services COVID-19 Scientific Advisory Group. I looked at data on infection rates and transmission patterns by age, and at models of school closure and the impacts of community transmission levels on school reopening experiences in other countries. There is a dizzying array of information available on schools and COVID-19 transmission in children. It can feel hard to make sense of it all, especially when it sometimes seems to be contradictory. That is why it is so important to look at the entire picture, not just one or two examples. What this review told us is this. First of all, if children are infected with COVID-19, they are more likely to be mildly sick and fewer are hospitalized. Secondly, childhood infections, particularly in younger children, do not seem to drive community transmission. This was equally true in places like Sweden, where elementary schools never closed, and in Finland, where schools did close. Third, young children seem less likely than adults to infect others, while older children seem to transmit infection in a way more similar to adults. This was seen in high school outbreaks in France and Israel, where elementary schools in similar areas did not experience the same spread. Having said this, it's important to remember that the outbreak in France occurred early in the pandemic, before public health measures were in place. And Israel's outbreak occurred in a context with almost 40 students per classroom and during a time when a heat wave meant that mask use was paused. Finally, it is abundantly clear that one of the main predictors of successful school reopening in COVID is the level of community transmission outside the school. Places with high community transmission have experienced much more spread in schools than places with low transmission. Places in the United States like Georgia, where school outbreaks have recently been identified, have a much higher daily new case rate than Alberta. In Georgia's case, this is more than 12 times our new daily case rate. It is also encouraging to look at some examples of COVID-19 exposures that happened in schools before school shutdowns occurred. There are several case reports from around the world, including Australia, Ireland, France, and Finland, where a total of 17 COVID-19 cases in all these countries were identified as having attended a school while infectious. Detailed reports of these cases concluded that of the over 1,900 contacts who were identified between all of these cases in these 4 countries, on follow-up, resulted in only 1 case of secondary transmission. This was before any COVID-19 modifications were in place in schools, and this included high school settings in both Ireland and Australia. We must take the pandemic seriously, and we also need to look at the whole picture. We must consider all the risks to our children and our communities. We can reasonably expect some infections at schools. Our job is to limit the number of these infections, prevent large outbreaks, and prevent onward spread of these sporadic cases. There are families for whom the risk of a sporadic infection is significant due to chronic conditions in the student or a family member. Each family must weigh their options and make the best choice for their situation. Teachers and school authority staff, like any workers, will need to be protected from hazards. This remains true. As always, I continue to monitor new evidence as it emerges and will adapt my advice on the school reentry plan as needed. As a parent of school-aged children, I have decided the value of in-school learning outweighs the risks for my family. That's why I'm sending my children back to school in September. But I want to be clear, there is no wrong decision about a return to in-school or online learning. Each parent is uniquely positioned to make the best decision for their family, and school authorities have worked to provide innovative options to support student learning wherever that may be. Regardless of your choice, taking precautions is our new normal for all ages, including our children. I believe together we can help our children reclaim this part of their educational and social development and minimize the risk to students and staff in schools. Today, we are also posting updated, detailed guidance on how we will respond to any students or staff who have symptoms in schools and what protocols will be followed if COVID cases are identified in a school. This can be found online on our COVID-19 website, and I hope this will help answer many of the questions we have been receiving. Again, I want to state we are all in this together, and we will succeed if we work together. Thank you, and I'm happy to take any questions you may have.
And we'll go to the phones now. Operator, please put forward the first question.
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. The UCP is using an op-ed from an Edmonton doctor to defend their back-to-school plan. Before it was recently corrected, the op-ed read, "It is exceedingly rare and maybe not even possible to acquire the virus simply by being in the same room as an infected person." So I have two questions for you. First, is that true? And second, do you think it's responsible for the government to be sharing unfounded statements about the pandemic?
I read the op-ed a day or two ago when it was first published, and I have to say that as a physician, when I read the statement about the difficulty or the fact that it's not necessarily possible to acquire the virus from being in the same room as a person, I have to confess that as a physician, my head first went to diseases like measles, where we know that if someone who has measles is in a room and then they leave the room, the virus can be in the air and can transmit through the air at very far distances for long periods of time. And so I have to say, as a physician, when I read that quote, what I understood the author to say was that this virus is not transmitted in a way like measles is, which is that very far distance, very long duration airborne transmission. I understand from looking at a correction that the author posted today is that it was her intention to indicate again that that is outside of close contact. So as we all know, being in close contact with someone, especially for long periods of time, face-to-face contact, is very clearly a part of COVID transmission, and in fact, probably the highest risk process for transmission is being in that close face-to-face contact with someone. So it's my understanding, again, from reading the original article, based on how I interpreted it as a physician and based on the correction of the author, is that her perspective would be very similar to mine. And with respect to the question of referencing the article, that would be difficult for me to comment on. Again, I can simply say from my own perspective that the statements that this particular author made were, again, in my interpretation of the more technical kind, appropriate.
Operator, please put through the next question.
Next is Silvana Benedict. My apologies for the mispronunciation, from Global News. Go ahead, Silvana.
That was perfect. Thanks very much, Dr. Hinshaw. Taking a look at the number of new COVID cases we have in Calgary, what are you able to tell, if anything, about how effective mask wearing has been or is? I know it hasn't been a long time that we've got it, but what are you able to speak to?
We are still looking at our trends, and as you may know, the numbers in Calgary have been declining over the past few weeks. We did see a small bump in those numbers over the last 24 hours, but haven't had time to go through in detail those particular cases. So I will say that I've been paying closer attention to the trends in Edmonton than in Calgary, so I'd have to take that away. But what I do know is the majority of the transmission that we are seeing across the province is transmission in social interactions. So we're seeing house parties, we're seeing private gatherings, those kinds of locations where transmission is happening, where you have one person who may be infectious, may not know they're infectious, spreading to multiple people at the same time in those close contact social gathering situations. We're seeing household transmission. So when somebody in the household, again, perhaps doesn't know that they're infected or infectious, has spread to the people that they live with. And we're also seeing some specific worksite transmission locations. And so there's a few examples of those that are on our website. We haven't recently, at least it hasn't been reported to me recently, that we've been seeing outbreaks in places like restaurants. So, whether or not that's a sign of the mask policy being effective, or whether that's a trend for people being more mindful of COVID restrictions, it's hard to say. But we are currently looking very closely at the data and looking at transmission patterns to try to understand whether or not there perhaps has been an impact from the bylaw. Of course, there are always many, many things happening at the same time, so it will be very difficult to say with any certainty whether the mask bylaw caused certain trends, but we can comment on the fact that certain trends happened after the bylaw went in. So that's unfortunately all the detail I'm able to provide at this time.
Operator, can we have the next question?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. There are now more outbreaks in continuing care facilities in Edmonton than I believe ever. What role do you think easing visitor restrictions at these facilities played? And with cases on the rise in our city, at what point might you look at scaling them back?
We do have a long list, unfortunately, of outbreaks in facilities. The majority of those facilities, in fact, I can think of only one example in the past several weeks when I've been notified where the first case was identified in a resident. Almost all the rest are cases identified initially in a staff member. The vast majority of our continuing care outbreaks are outbreaks where there's an individual staff member identified as a case. An outbreak is declared as a precaution, and yet there's little to no onward spread because of the universal precautions that staff are taking while working in these facilities. And so at this time, it doesn't look like there has been a significant impact with respect to transmission in facilities from our change in our visitor policy. We are looking at that closely. That is a part of our ongoing evaluation, is to be watching our outbreaks in continuing care to determine where it seems that an introduction of the virus happened. But to date, it does not seem like the visitor policy change has been a significant factor in the number of outbreaks, but rather what we're seeing is increased community transmission in Edmonton, and unfortunately, when that happens, there is an increased likelihood of individuals who work in these facilities being exposed as they're out in the community.
Operator, please put through the next question.
Next is Matt Woodman with CTV Edmonton. Go ahead, Matt.
Hi, Dr. Hinshaw. I have two questions regarding schools. The first one is, what kind of rules will the province have in place for substitute teachers this year? Will they be able to substitute at multiple schools, or will they be restricted to one school in order to limit the risk of COVID-19 spreading? And my second question is, we spoke with a teacher today who raised, I thought, a good concern about the idea of cohorts. She understands the concept, but her concern is rather that a lot of students have multiple cohorts. So, for example, their classroom cohort, their bus home cohort, their hockey cohort. They might be in music lessons, for example. And then who knows how many cohorts their family themselves have with neighbors, family, that sort of thing. So my question is, how effective is the cohort system when some people have maybe 4 or 5 different cohorts?
With respect to the first question about substitute teachers, that would be a better question for the Ministry of Education. There is some new guidance available online that has been worked on between health and education, and there are some considerations in there for substitute teachers, but with respect to the actual policy about requirements or limitations, those would be requirements that would be set by the Ministry of Education. The second question about cohorts, there's a couple of things to say to that. One is that cohorts are the most effective when parents are regularly screening their children before starting an activity. So when children are screened in the morning and before they go to school, if they have even mild symptoms, they should be staying home. The parents should be arranging for testing. And if they are going from school to hockey practice or to one of those other cohorts, parents ideally would be checking to see, is their child feeling well? I know for my kids, often you can kind of tell if they're feeling a bit under the weather, asking them how they're feeling if they look a bit off, and then having a very, very low threshold for taking them home instead of to those activities. And so the cohort model partly depends on that regular symptom screening. It also depends on parents' ability to consider who in their more personal cohort might be at higher risk. And with schools starting, I have made a recommendation that parents might consider their more personal cohort, perhaps limiting social gatherings or having time spent with others outside of the household in the first several weeks of school so that we're able to get back into school routines and patterns, and we can all learn to adjust to this new normal before moving into more of that social interaction again, just to limit the total number of people that we're in contact with.
Operator, please put through the next question.
Next is Shannon Scott with CBC. Go ahead, Shannon.
Oh, hi, Dr. Hinshaw. We'd like to ask some questions about the event in Deadwood today, just to follow up. We're wondering if you could explain why you decided not to implement restrictions on the number of people at outdoor religious gatherings when there are limits for weddings and funerals. After what happened at the gathering in Deadwood, we were wondering if you had any plans to change your recommendation. I'm also wondering if you know and if you can share kind of what was happening at that event. Were people sharing food? Were they sleeping in small rooms together? Why are we seeing so much spread from that event?
With respect to the question about the difference between a religious service and a wedding or a funeral, that difference is due to the fact that a religious service typically, and it sounds like the weekend event was perhaps an exception to that, but typically a religious service, people would be attending for the service particularly, and then they would be leaving, whereas a wedding or a funeral, usually it's more of a social event. People would be mixing and mingling, spending more time together. It would be more difficult to have that distance maintained at all times. And so that's the difference for having, that's the reason, for having that difference between the maximums for weddings and funerals and the maximum for religious services. The question about the exact protocols that were followed, that's something that my colleagues at Alberta Health Services would likely have. I haven't seen the details of the protocols that were being followed, but I do understand that they were using distancing and that there were protocols in place. But unfortunately, I don't have those details. That's something that we could look into and provide to you if that's of interest. So, and that, of course, is part of the ongoing investigation to determine if there were some breaches that resulted in the number of cases that we're seeing from that particular gathering. But I do want to emphasize, we know that we've seen clusters of cases from many different events. So this is one example, and it's an example that we are investigating and making sure that we're publicizing because of that risk of secondary spread. And yet we have had other outbreaks, and with any outbreak, we need to make sure that we're treating those who are diagnosed with COVID with compassion, that we're not shaming them, and that we're making sure that we're learning lessons so that we can provide those lessons to organizers of similar events so that we can prevent this from happening in the future to every extent possible.
And we're going to take a couple more questions. Operator, can you put through the next one?
We have Jordan Olmsted from the CBC. Go ahead, Jordan.
Hi, Dr. Hinshaw. I don't think we've seen new modeling since the end of April, so I was wondering what the modeling that you are seeing is telling us about how the start of the school year is expected to impact COVID-19 cases and transmission in the province, as well as when we can expect to see those new modeling projections posted publicly.
We have been working on a few different models, and as you'll remember from the spring, a model is not a crystal ball, it's not a prediction of the future. A model is a way to test different hypotheses and to look at possibilities. And so we haven't completed that work yet. We're still looking at that. As you know, the information and evidence around COVID-19 continues to evolve, and a model depends on assumptions that are made and parameters that are set. So we're still in discussions about how to fine-tune it. So I don't unfortunately have a specific time at which point it will be available for release to the public, but just to say that it is something that we are currently working on, and so hope to be able to have that available when it's complete, but unfortunately I don't know exactly when that will be.
Operator, can you put through the last question?
Final question is Jeff Levin with the Edmonton Journal. Go ahead, Jeff.
Hi, I was wondering if I could get some more details about the outbreak at the Imperial Oil Strescona facility, refinery.
Sure. I think I have that. Just one moment. There are 6 cases at the Imperial Oil Refinery at this time. 3 of them are active and 3 recovered. So that outbreak will be listed on our website tomorrow, as it's now crossed that threshold to have more than 5 cases. So local public health is working very closely with the organization, with the company, who are working very hard to make sure that any contacts are identified, that they stay home, that testing is offered. And so again, at this time, there are 6 cases total at that particular site.
And that's it for today. Thank you everyone for joining us. Dr. Hinshaw will provide the next update on Monday. Have a safe weekend.